Good afternoon, everyone. Welcome to Yashoda Hospital webinar series. I am Dr. Amar, AVP Yashoda Hospitals. Today's topic, pressure injury. We are covering today basics of assessment tools, prevention and management. I would like to introduce today's expert panelist, Dr. Kaladhar. He is a senior consultant and HOD critical care, Yashoda Hospital Malakpet unit. And he is having vast experience in critical care medicine, and he has handled most of them more length of stay patients. And today he will introduce, he will give overview on the how to manage pressure injuries and how to prevent it and what are the tools to handle the pressure injuries. Today I would like to introduce today's speaker, Ms. Bhulakshmi. She is DGM nursing Yashoda Hospital Secunderabad. She is having more than 14 years of experience in nursing care, and today she will overview in the brief what are the steps, what is the pathology, how we are handling more length of stay patients, and what are the standards protocols to overcome these problems day to day. All we are know, like pressure injury is one of the main reasons for patient length of stay will increase, cost will increase, infections. So now I request Ms. Bhulakshmi to start today's webinar, and after webinar I request our expert panelist to put his opinion on and give the guidance for today's topic. Bhulakshmi, please start.
Thank you, sir. Thank you so much. So good afternoon, one and all. Today's topic is on pressure injury, basics of assessment tools, prevention and management. So as we are all know, the definition of pressure injury as per National Pressure Ulcer Advisory Panel, it defines pressure ulcer as a localized injury to the skin and or underlying tissue, usually over a bony prominence or related to the medical or other devices as a result of pressure or pressure in combination with the shear. So there is a localized injury because of the direct pressure or friction and the pressure on the bony prominences, because there will be less muscle mass over the bony prominences. So the patient might get the pressure ulcers. So what are the common areas of pressure points are like the patient is on supine position, patient may develop at the back of the head, and then shoulder areas, elbow, buttocks, and heel. And the patient is on sideline position, patient may develop at ear, shoulder, elbow, hip, and thigh, leg, and heel. These are the pressure points for us. And if the patient is on prone position, the areas of pressure points will be elbow, rib cage, thigh, knees, and the toes. So why the pressure injury will be developed for the patients? So when there is a body weight pressure and the surface pressure is having a friction over there, and the prolonged time period, if the patient is on the same position and the friction will be more, and it will automatically stop the capillary refill to the tissues, and wherein there will be less blood circulation, oxygen, and the nutrient supplementation will be less, and automatically it leads to the cell death and the tissue necrosis. Hence, the bed sore will be developing for the patient. So what are the different stages of the pressure ulcer? So if you can see, there are 4 grades. So the grade 1, which involves the epidermis layer, so where on the over the skin we can see a redness. So it's just a redness which will be developing, and we can see a dry skin over there. And in the grade 2, the dermis layer will get involved into the skin, and then the tissue, we can see tissue damage will happen over there, and the skin discolorations will happen. In case of grade 3, it involves the muscle and it involves the adipose tissue formation as well, and then the patient might develop a deep wound over them. And in the grade 4, we can always see the muscle will get involved and there will be a deep tissue underlying, and then the deep tissue involvement will be there and muscle involvement will be there, and automatically sometimes for few patients we can see the bony prominence which will be evident and which will be outside visible in the wound. So how do we prevent or how do we manage these pressure ulcers? So the most prevention is more better than the management over there. So wherein our crucial nursing role will place a greater this thing over here. So we have to conduct skin and risk assessments every frequently during the shift change and all. We have to manage the moisture, optimize hydration and nutrition, and we can minimize the pressure, shear, and friction, and we can treat the pressure ulcer. So the first and foremost thing is we have to do a skin assessment and we have to identify what is the risk and which the patient will develop pressure ulcer or not, that we have to identify. So for that, first we have to understand. Sorry. So first we have to understand what are the risk factors. So we have to do skin and risk assessments, which will be done. So here I'm imposing one question to everyone, to the audience. So what is the scale which we most frequently used in the hospitals for checking the pressure ulcer? So yes, as all of you has answered, it was the Braden scale which we will be using to check the pressure ulcer. So we can assess and document the skin condition on admission, and every shift we can assess the skin condition. And the most widely used scale is Braden scale. And then we can assess risk within 1 hour of admission for the patient. We have to go for this Braden scale assessment, and we can assess the risk every frequently. On every shift, we can assess the risk and develop an individualized care plan for every patient. And what are the factors which are underlying for developing a pressure ulcer is the pressure. The pressure is the direct force which is being developed from the body force to the surface area, and the friction which will be developing from, suppose if there is a wrinkle on the bed, so that will become a friction for the patient in order to develop a pressure ulcer. And the shear is when the patient is sitting on the bed. So the opposite direction, if the body is getting moved, then the shear will happen. And the microclimate is like when the patient is continuously on wet or incontinence of urine, and also that also will harbor the microorganisms growth, and it will be impacting the pressure ulcer. So there are other factors as well, extrinsic factors and intrinsic factors, like pressure, shear, friction, and microclimate are the extrinsic factors. And along with that, there is poor hygiene. If you are not maintaining the hygiene factors and the drugs, and if there is a restraint and where we cannot, tie the hands or limbs very distinct tight, and wherein it will develop the pressure ulcer over there, because we are always hindering the blood circulation over there. And inappropriate positioning while sitting or while lifting the patient, or while if you're moving from one bed to the other bed, or moving from wheelchair to the bed. So if you are poor lifting, then always it will be resulting in the bed sore to the patient. And there are intrinsic factors like always age, infection, and body weight, body type and weight, and circulatory disorders. If there is any neurological deficit, incontinence, and reduced mobility to the patient, if there is disturbances in the sleep and rest patterns and poor nutritional status, if the patient is on dehydration, mental status, all these are the intrinsic factors where the patient might get pressure ulcer. So we have to rule out all these risk factors so that it will be easy for us to identify the patients, those who are at risk of developing a pressure ulcer. So coming to the Braden scale, which we will be using very frequently at the time of admission, or on every shift, we will be assessing the pressure ulcer. That is the Braden scale. So the parameters of the Braden scale are 6 parameters. So sensory perception, where we have to check whether the patient sensory response to the skin is perfect or not. So based on that, we will be giving the score, and the moisture to which the degree to which the skin is exposed to the moisture. If the patient is constantly moist, like if the patient is continuous on dripping of the urine or incontinence or not having proper ventilation, then the patient might develop a pressure ulcer. And coming to the activity, degree of physical activity, the patient is confined to the bed, a chair, or walks occasionally, so walks very frequently. That also, if the patient is confined completely to the bed, unconscious, the patient might be at very risk. Then mobility, coming to the mobility, ability to change and control his body positions, like whether he is able to do his body movements on his own or he needs some support. So based on that, the patient risk category we can identify. And the nutrition plays a very important role over here, because if the patient is undernourished or malnourished, the patient is more prone to get the pressure ulcer, because there will not be a muscle mass over there. The bony prominences will be more accurate, and the patient will have a friction over there and develop the pressure ulcer. So the last important factor is friction and shear. So that means if you are not following the proper supportive devices and then patient is on improper positions and wrinkle bed, so all these will result in the friction and shear. So based on that, we will be scoring the patient risk category. So if you see the patient scoring, if they are at 15 to 18 score, then the patient is at risk. So for that, we have to take all these measures, so which we'll be discussing in detail later. And if the patient scoring is 13 to 14, then we will be concluding it as a moderate risk. And the patient is at 10 to 12, then we will consider the patient as at high risk. So we have to be much more careful not to get the pressure ulcer for the patient. And if the patient score is 9 or below, and the patient is at very high risk. So, and that is for the adult Braden scale will be used. And if you have pediatric patients, and we can use this pressure ulcer risk assessment, which is called as Glamorgan pressure injury assessment record, which we will be using for the pediatric patients. So all these are like, we can also check for the children, whether they can able to move from the bed or position, can they change on their own? And then based on the age, whether the mobility and activity is there or not. So any equipment, patient is connected to any devices, any medical equipment. So that is also one of the risk factor here for us. And if there is any significant anemia to the patient and persistent pyrexia and poor peripheral perfusion, inadequate nutrition to the baby, and low serum albumin, weight less than 10 centile, and incontinence. So all these factors we will be evaluating, and an everyday basis, we will do the assessment for the pediatric, and we will be giving the score, and appropriately based on the score, we will be taking the measures for this. And suppose already the baby has developed, the child has developed the pressure ulcer, then we have to use this scale for us, like we can identify where is the pressure ulcer and we can mark on it, and you can describe over the table. So next factor is, that is all we will be assessing the patient, assessing the risk factor for the patients. Now, next point is we have to manage the moisture. So we have to use any cotton pad. Suppose if the patient is continuously passing the urine or continuously passing the motion, then we can use the cotton pads that where it can be wick away the moisture. And we can use the topical agents, which can be like emollients or lotions, so that the skin will be intact. And do not massage or vigorously rub the skin, because skin breakdown can happen and it will be very fragile. So cleanse the skin following episodes for incontinence. Suppose if there is incontinence or tripling of urine, please clean the skin properly. And diapers, we always avoid the diapers because it always harbor the microorganism and wherein the skin rupture can happen. And always we have to involve the family and the caregivers in this. So, and the next important factor for preventing the pressure ulcer is hydration and nutrition. So both plays very important role, because nutrition, if the patient is undernourished or malnourished, obviously the patient will be prone to get the pressure ulcer. And if they are not taking the food also, the immunity status will be very less for the patient. So make sure the patient is having a sufficient diet, which is composed of protein, calories, and vitamins A and C, which will promote the wound healing as well as it will improve the immunity status of the patient. And the last important factor is the hydration, because dehydration, if the dehydration is there, there will be skin wrinkles and skin dryness, which will obviously result in the risk factor, pressure ulcer. So we have to avoid the dehydrational status. Always hydrate the patient. You can moisturize and you can give additional fluids for the patient. And the next important factor is we have to minimize the pressure, shear, and the friction. As I already told you, we have to use offload pressure over the bony prominences. Suppose if you are making the patient to sit in 90 degrees and all, what will happen is the back of at the rib cage, patient will be having, at the back sacral area will be having a lot of friction and shear. So that what will happen is, so the body skin will be going up and then pressure will be pulling downwards. So to avoid that one, we have to position the knees in a slight flexion, and we have to use the foam wedges in order to support the heel as well. And reposition the patient every second hourly. We have to change the position of the patient and use only 30 degrees. If the patient, if you want to keep it in a head up position, use for 30 degrees angle. And provide adequate support services. Like suppose if the patient if you want to use soft pillows, you can use, and you can go for air mattress or water mattress. And then we can use the foam wedges, and you can use heel supporters or heel pads. So in order to prevent the pressure ulcers. But we should not use like water-filled gloves or intravenous fluid bags just to avoid the pressure ulcer. Don't depend on those. Always go for this mechanical devices which will be supporting for the patient. And always provide wrinkle-free bed to the patient, and then do not drag or pull the patient from up to down. So always use a proper lifting techniques and use lift sheet while you are transferring the patient from bed to the stretcher or to the wheelchair. And these are the most of the preventive actions or preventive measures which will be taking care. And when it comes to the management, suppose already there is a pressure ulcer. So how do we manage that pressure ulcer? Is always there will be a wound. So we have to assess the wound and what type of exudate, what type of tissue, whether it is healing or whether it is deteriorating, that assessment is required for us. So based on the exudate type, we can easily identify whether the wound is getting deteriorated or it is going to be healed. Suppose if it is in the healing status, then the wound can be in a serous or sanguineous state. So where in the serous means which we can see a watery plasma kind of fluid which is coming out from the wound. And then sanguineous is like a light bloodish color will be coming out of the wound. And serosanguineous is it's a mixed with serum and as well as the bloody water, which will be a pale red or pink. And then purulent, which is of more dangerous because it's an pus formation, which indicates the wound infection. So based on the stages of this exudate type, so we can go with the treatment modalities for the wound. And based on the tissue type also, we can able to easily identify whether it is healing or not healing. So if the tissue type is pale pink, and then that indicates there is a poor blood flow and anemia. And if it is yellow, that means it's a non-viable tissue because there is no blood circulation. It is a very sloughy kind of thing. And if it is a beefy red, that means granulated tissue because that is a good blood flow and which will be a symbol for the wound healing process, good wound healing process. And if the tissue is a black or brownish color, then that means it is a necrotic tissue, wherein we have to go for debridement or tissue reconstruction has to happen over there. So, and always if there is a wound, we have to go for wound dressing, always protect the wound, and we have to go for debridement. It depends on the treatment, depends on the consultant, what type of treatment modalities we have to follow for that. We can go for starting of antibiotics also for that. So this is the most important factors wherein we have to prevent the bed sore. It's not for the management of the bed sore. Always depend on the prevention. Thank you.
Hello. Yeah, it's a thank you, Ms. Bhulakshmi. Session was good. And I would like to request now our expert panelist, Dr. Kaladar, please just to put your opinion on today's topic of pressure injury and just take us through and just please tell to the viewers on today's topic.
Thank you, Dr. Masar. Thank you, Bhulakshmi, for such an illustrating with figures and tables. I think you elaborately told about everything about pressure ulcers, right from the definition, the prevention, the assessment initially, then prevention strategies and the management. I think you elaborated it very in a vast way.
Thank you, sir.
So anyway, overall, the important thing is, practically how we proceed whenever any patient arrives. As you said, the prevention strategy, prevention is always the key. And you should be starting as early as possible. As you were stating in one of your slides that within 1 hour, the assessment should start. Especially if I take an example, different examples of an ICU. So in critical care units, the patients will be sick, critically ill. They are at very high risk of developing these pressure sores. The patients are poorly having nourishment and all, and very bad illness. Most of them, they will be restricted to the bed. For example, if I take the patient with a severe acute respiratory distress syndrome, where we need prone positioning for these patients. So extended period of proning almost for 16 hours a day, it needs initially when the patient is very severely ARDS. So these patients, yeah, definitely how do we have a different prevention strategies as you are pointing out, using multi-layered foam dressing, like prevention strategy before where the points, which as you are showing some figures where in prone position, where elbows, the head and all, the hip regions, they will be exposed and chest region, of course, exposed towards high pressure and they lead to the pressure source. In those areas, the preventive strategy is something like putting the multi-layer foam dressing beforehand, before the pressure source develops, definitely helps. We had seen in our regular practice where we prone these patients, we use multi-layer dressing at pressure points and elbows also, especially, and the ankle regions and all. So this is the prevention is key. So overall, as we look at the bed sore, it is a very important quality indicator, I can say, in ICU. So there are different strategies as we were discussing. One of the strategy, very important strategy, is staff education. So the staff education about preventive strategies, like what are the different preventive strategies? For example, position change. So there will be sometimes the junior staff and all will not be they will not be that much oriented that the position change has to be done every 2 hours. The rationale behind is after 2 hours, the microcirculation of the pressure point changes, and the possibility of the microcirculation getting ischemia is high, where there will be the possibility of the pressure sore development. That is the reason every 2 hours change is very important. That has to be ascertained and told to the staff and educate them according to that. And sometimes if we use standardized forms how to document like what is the various stage of the pressure ulcer. Suppose it's stage 1 today, somewhere healing started. It's a standardized form where it is depicting the figure. Suppose in a buttock area, there is some grade 1, it has happened, slowly it is progressing. So depending upon that, you will be able to manage accordingly. Like you will be modifying your steps towards managing those patients. And along with that, maybe if the bed sore incidence is high in or ICU or something like that, probably one of the nurse among all the staff, making them as a skincare champion. So that nurse will be looking specifically, as we use infection control nurses, where specifically they look at the infection control practices. So we can put one nurse as a skincare champion. So she will be looking after all the patients, assessing whether anything wrong is going on, regularly assessing the bed sore and all. So in that way, she will be able to help changing the strategies, and that way the occurrence of the bed sore may be on the lesser side. And proper important thing is nutrition. Yeah, most of the time the nutrition plays a very important role in this type of patients. And the nutrition is not taken care properly in terms of calories and protein intake, because these patients have chronic catabolic state. So if you are not giving proper calories and proteins, definitely it will not aid in wound healing. It already pressure so developed. If it is not developed, the possibility of pressure sore development is very high in these patients. And at the same time, these are the different preventive aspects that we can do regularly, and regularly discussing this and looking at what are the practices we are on the scale of where we are, like whether we have to improve further and all. Regularly looking back and discussing all this with the staff as a unit day meeting and something like that, it also helps a lot. Regularly reviewing those charts. And one more thing, actually, outside the skin, maybe. Are you able to hear me?
Yes, sir. Now
Can hear.
Yeah. There was some small technical glitch. Yeah, basically these bed sores sometimes outward they look like the skin will be normal, but there is a small black edge cut. But deep beneath the bed sore is very deep. So these type of things we should be paying attention. So overall, these are the practices that we have to employ. I think it was a nice lecture, and it was nicely illustrated with all the possible figures. Thank you. Thank you very much.
Thank you, sir. Thank you so much. And Ms. Bhulakshmi, any questions are there? Just see once. So sir will be take 1 or 2 questions if it is
there
there.
is one question from Leela. How can we observe pressure ulcer in case doctor advises if no position change till further orders?
Yeah, basically this is most of the times the neurological patients, especially cervical spine instability, the patients who are having a cervical spine injury initially, probably those patients, until we stabilize their cervical spine, that happens. But yeah, these type of patients also, most of the times we will be securing this cervical spine fixation surgery. Once it is done, most of the times they can be done this side and that side. So probably that will not be very long period. So the type of patients what we encounter, like totally immobilized to one position, is a bit less. The patients who pose the most challenge is Burns patients and something like Steven Johnson syndrome patients. Like they are, after drug reaction, they develop extensive toxic epidermal necrolysis. These patients are very high risk of developing, because already their skin barrier is lost. After that, if you are not doing proper, following proper prevention strategies for bed sore, they are at very high risk. So yeah, other than that, the position regarding position change, it is most of the times brief period it happens.
Thank you, sir.
Any
That's
other
it.
question, Bhulakshmi?
No, sir.
I really thank you, sir, being your presence today, in spite we having the busy schedule, and I think you've taken out time and you came today, and it was very valuable, your inputs. I think hope all our audience will execute day-to-day practices, and it will definitely help in patient's outcome and patient care, especially nurses. This is 80% of the job where nurses can prevent, and they can do major wonders into the prevention of the pressure injuries. Thank you so much, sir, being here today. And really thank you, Bhulakshmi, for making today's presentation very simple and understandable. So thank you so much. Thank you, Yojana, for coordinating complete today's event. Thank you so much. And we are having a couple of weeks after 12th Jan, most probably, we're having final quiz finale. And we have come up to the semi-final. I think be updated on our Facebook page, Yashoda Facebook page. So we'll get to more interesting topics. Thank you. Thank you, one and all. Thank you.
Thank you, sir.